Thank you very much, Ben, and welcome again, everyone, to the Global Protection Forum. Today's session is going to focus on advancing protection in prioritized humanitarian action. It's a very timely discussion for all of us in light of the ongoing humanitarian reset and other key reforms processes. To start us off, it's my pleasure to introduce Dominic Stillhardt, the head of humanitarian aid at the Swiss Agency for Development and Cooperation, for some opening remarks. Ambassador, thank you so much for joining us today, and the floor is yours.
Thank you very much, Marie, and good morning, good afternoon to all of you, dear colleagues. I'm very pleased to have the opportunity today to speak to you in this very important session. Over the past days, we've heard more and more stories of, and actually terrible, horrific stories of people who survived the capture of El Fasher. I have a very special interest in Sudan because I spent 5 years in the Sudan, including during the Darfur crisis 2003 and to 2005. And I spent actually part of my weekend reading these accounts and reading all information I could get from Darfur, from El Fasher. And I mean, these stories are really unbearable. They are unbearable stories. And this morning I heard another account of a woman in Tine who was interviewed by a radio journalist, and she simply broke down in tears because she suffered the worst of violence you can imagine at the hands of the RSF. And it became clear to me one more time that whilst food assistance is important, whilst shelter is important, whilst medical care is important, protection from violence is the first and foremost need of people who are affected by conflict and violence. And protection, therefore, protection from violence is life-saving. That is why we are talking about the centrality of protection. That is why designing effective strategies to prevent and put an end to violations of international humanitarian law and human rights law is a leadership issue for the humanitarian system at large. And that is also why the humanitarian reset puts protection and the rights of women and girls at the very center of the humanitarian response. The aid memoir to the JASC policy on protection and humanitarian action that was issued in October 2024 is, in my view, a very valuable tool for humanitarian country teams in this regard. The policy actually requires humanitarian country teams to work together to understand and seek to prevent, mitigate, or end protection risks that people affected by conflict and disasters are facing. And the aid memoir offers practical guidance to the humanitarian coordinator and the humanitarian country teams how to implement this policy. And it is, and what is also important is that this aid memoir puts a particular emphasis on working closely with affected populations and working with local actors. Donors, member states, obviously have a very important role to play. They not only are responsible to respect international humanitarian law, they are also responsible to ensure respect of international humanitarian law. And they have many instruments at hands to do so. They can call out violations. They can use quiet bilateral diplomacy, multilateral diplomacy, but also, and this is really important, especially now, they can fund, and they have to fund, and they will need to continue to fund protection actors. Switzerland is doing all of the above, and we are also co-chairing. We are actually privileged to co-chair the protection donor group together with Sweden. With less funding available, protection becomes even more critical, because it is the only humanitarian activity that actually is shrinking needs, or is aiming at shrinking needs. And in addition, if well done, it also paves the way for peace and reconciliation. And you protection actors are obviously key in helping us to reach that goal. And I would like to really express my heartfelt thanks to all of you for your efforts in this space. We need you more than ever. Thank you very much.
Thank you, Dominique, for those very thoughtful remarks and for talking about what is happening in Sudan and why protection needs to be prioritized. I think this is a perfect introduction to the panel discussions that we will have today with a range of partners. So thanks again for joining us, and thanks to Switzerland for your continued support to protection. The panel today is going to be moderated by Gemma Connell, the Chief of the Strategic Prioritization and Practice Branch at OCHA Geneva. Gemma, we are really delighted to have you with us, and we are very grateful that you've accepted to moderate this discussion. So I will hand over the session to you, if that's fine. Thank you again for joining us.
Absolutely. Just to check that you can hear me?
Yes, perfect.
Wonderful. Colleagues, friends, thank you so much for being online today for this really important and incredibly timely panel, where what we're going to talk through is protection, as Dominique just said, in a world where we are forced to hyper-prioritize humanitarian action because of the devastating funding cuts that have hit the work of so many of you who are online today all around the world. And so we've got an incredible panel that is joining us from locations around the world who are going to ground truth the reality of how these funding cuts are hitting home in their day-to-day work, but also the amazing work that they are doing on the ground to ensure that protection remains truly central, not just in words, but in action as we go through this period of a massive change in the humanitarian system and as we collectively cope with these dramatic funding shortfalls. Just to quickly put this in perspective, and I promise you I will be brief because the people we want to hear are those who are online from country operations. We have, as we stand here today, collectively received around $11.2 billion against the global humanitarian overview. To put this into context, that is less than half of what we had collectively received at the same time last year. So we are coping, all of us around the world, with less than half of the resources that we had before, when we know that the crises that we are responding to, Dominique spoke to Sudan, we will have colleagues online from around the world, from DRC, Colombia, and other places who are going to speak to what this looks like in their context. But what we know globally is this means thousands of staff have lost their jobs. Hundreds of offices and sub-offices have been closed. And most critically, the people who rely upon us for that last lifeline of assistance can no longer rely on it because we simply do not have the money that's needed to deliver. So within that environment, we have had to have excruciating discussions in the humanitarian community about who we will target and about what we will aim to provide to them. And the panel discussion today is our reality check on whether or not, with all of the efforts we've made globally, we have collectively managed to keep protection in the central place that it must be within this prioritized effort. I'm often asked globally whether or not focusing on life-saving assistance means that we sacrifice protection. And I'm here to kick off the panel by saying it absolutely does not. Life-saving assistance means providing the best and most dignified response we can deliver for people in crisis, and protection absolutely must be integral to that. So anyone who's come to this panel with the question of whether or not focusing on life-saving means we don't do protection, I am here to tell you the answer is absolutely not. Protection has to be central to every effort that we make globally. So without further ado, let's go ahead and dive into this incredible group of panelists that we have here to discuss today. Questions around how these aid cuts have impacted protection, questions of how protection partners have reacted to hyper-prioritization, and how internally protection actors are understanding how they capitalize on their capacity, on their presence, on their networks to really ensure that from the child in El Fasher who's under siege and under attack to the child in Haiti who is being impacted by the violence there and everyone in between, that we keep protection at the core of what we do. So for the first part of our discussion, we're going to look at the humanitarian reset. How has it been so far? And how are partners who do this protection work, this critical protection work day in, day out, are reacting to it on the ground? And I'm really thrilled that we'll have colleagues from the DRC, from Ukraine and Colombia for the first part of this panel. So let me first turn to Kasia, who's joining us online from Ukraine. Kasia is the cluster coordinator in Ukraine for protection. So Kasia, let's kick off today by you telling us, as a protection cluster coordinator, how have you navigated the humanitarian reset and the calls for hyper-prioritization? And have you seen risks or opportunities, because both are possible, for the protection response in the overarching discussions around protection in Ukraine? Over to you, Kasia.
Thank you so much, Gemma, and thank you for all the reassuring support to protection. Listen, I think, like, looking back at this year, it has been really marked by prioritization efforts, and these efforts have not been easy on us. In Ukraine, I think you can divide it in 3 stages where we had to navigate these challenges, and that was the reprioritization of the HNRP back in January, February 2025. Then we had a cluster fit for purpose exercise where we were reflecting more collectively on transition and where we stand. And then finally, now we are dealing with the Humanitarian Needs and Response Plan 2026, which in Ukraine is done in a very unique, innovative way through issue-based approach, which is also a way of prioritizing our response. So I would like to think that, you know, the risks always offer us actually opportunities. So I selected 2 risks that I would like to highlight and explain as well how they have translated for some opportunities for protection actors. The first risk was related to the really, in the early stages of this year, need for more clarity and explanation of value added of what operational protection responses are on the ground and what impact they have for people who suffered from violence. That has been a huge risk. We have been shaken quite a bit as protection community and challenged as well. However, it really helped us and pushed us in the direction of solidifying our alliances. And the alliances, that means, you know, alliances with donors. OCHA has been also very supportive here to bring up protection to the forefront. National NGOs, authorities who were counting on the complementary protection services, and as well with our child protection GBV colleagues, we really came together to come up with very simplified, basic explanation on what the impact of protection activities are, meaning, you know, maybe giving up compromises on the technicality of our protection responses, but we're very clear about it. The second risk that we were facing was, you know, related at the beginning to the issue-based approach. Our humanitarian coordinator took this very courageous approach and really, you know, took lead on pushing the operation in this direction, including the cluster coordinators. And you can imagine how uncomfortable we were all feeling at the beginning of it, right? Because it's a completely, coming out of our comfort zone, new ways of working that we had to dive into. On the other hand, looking back by a few months, I think for protection, there were really huge gains and opportunities behind it. So basically, we were given quite some flexibility as cluster coordinators, and protection cluster co-chaired the strategic priority. We have 4. One on evacuations and the other one on the support to vulnerable IDPs. And through that, we were really able to embed the protection thinking, the centrality of protection in how these 2 strategic priorities were scoped, what were the needs and what were the responses. We were also able to apply a people-centered approach in our targeting methodology, taking into consideration severity 3. And it's very related to protection priorities, and that's my last point on this stage, just to explain that basically it allowed us to, through this new response, reach out to the pockets of vulnerable IDPs, including in West and Center, very small targets. However, extremely important for the mitigation of risks of premature returns, secondary displacement, and negative coping mechanisms. Through this assistance, being able to assist these vulnerable IDPs where they are, we mitigate these risks. And that was all possible thanks to the issue-based approach and the leadership of the humanitarian coordinator, and us turning, being more creative and innovative in the process. Back to you.
Cassia, thank you so much for walking us through that, and thanks for the amazing work of the protection cluster in Ukraine. I think there's 2 things there. One is how we make the case for protection and do it in a way that non-technical people will understand and buy into. And 2 is how we see changes as an opportunity and really capitalize. And Naomi, what we'd love to hear from you is how, as an HCT member, so a member of the humanitarian country team, you discussed prioritization, how you looked at it within the context, and how did you make sure that there was a central space in those HCT discussions for protection and for gender? Naomi, thank you so much again for joining us, and the floor is yours.
Thank you very much for the question. And I think that in DRC, the centrality of protection is a long time discussion in terms that it is protection crisis in the narrative. Maybe it's not always in the planning, but also, the narrative about food security is because of the conflict. And so food insecurity focus in some areas is very linked with the displacement partners and with the human rights protection, with the protection of civilians, the linkage with the mission work and all these elements. So the first thing that we discussed a lot and we put on the table was to apply the reset principle to take in, while keeping into account like good practice on DRC, on empowering also the local actors and the linkage with the centrality of protection strategy, which was updated last year. So it was very timely for the HCT, not only have the protection cluster work plan and like HRP, HRNP and so on, but also the strategy for the humanitarian country team. The gender engagements were there, and this crisis, this narrative crisis as a protection crisis, looking at the new displacement setting, because the problem of the prioritization in DRC was that it happened at the same time of a big change in the emergency response, because we got the occupation of Goma and the division of DRC eastern part in an area controlled by the government and an area controlled by de facto authorities. So change in access, change in displacement setting with the closing of the IDPs camps, and a lot of returnees movement, including forced return movement, and a completely new humanitarian setting, new needs, and less money. Also because DRC was very, very dependent on USAID, were like up to 70% of the overall humanitarian response, and protection was less than 40%, but still very important impact on the matter. So the discussion and the putting on the table was, between brackets, quite easily, because the narrative of the crisis was helping us to maintaining all the engagement in mainstreaming, looking at what were the major entry points for each area of the prioritization, what we could have kept to ensure that our centrality of protection strategy, our key points, were addressed in looking at that. And this is visible in the funding, because this in HRP, which is funded at less by 30%, the protection sector is funded at more than 60% right now, if you look at FTS. So that's a good signal in how we have been able to continuing this narrative. Of course, we have much less money, and we have a scale up of the crisis that we didn't even discuss it very much, because we were very stressed in adapting to this very disruptive situation where we lost a lot of funds. But maintaining the central space for protection and for gender, I don't think that was a huge challenge, because there was a lot of consensus. And we have a very strong GBV-IOR, probably the largest in the world in terms of field presence. There are more than 400 members, well, some with very low capacity, but is a huge and big network who has worked on sexual violence for years. And even for 20 years of joint UN programming. So there is this like awareness about the protection crisis and the gender lens, in particular for gender-based violence, but also for other elements of gender. And there is last, the technical element, because as our HRPN is activity-based, we can like advise and work with we do this cluster defense each year, and we just did that, and we were looking at that with the activity based, ensuring that one of the activity was like linked with the protection strategy or lens. So that's my 3 main points.
Thank you so much, Naomi. Very, very clear in terms of both how you bring the discussion at the strategic level, so how you navigate keeping protection central, doing hyper-prioritization at the same time as the crisis is really escalating with major protection concerns, including sexual and gender-based violence there in Eastern DRC, but also down to that really technical level of making sure that when we're doing the cluster defenses and the cluster reviews, that protection is integrated throughout the process. So huge thanks for sharing those insights and that experience. We'll shift across to Colombia now, and I'm really thrilled that we have Pedro online. Pedro is the Executive Director of Apoyar in Colombia, and that's the co-chair of the localization task force, as well as a member of the Global Protection Cluster's community-led protection task team. Pedro, thank you so much for joining us. We'd love to hear from you on how you, as a local actor, have been involved in shaping decisions on prioritization, and whether you see any good practices that you could share with colleagues online for them to reflect on, or also any reflections you have more broadly on how we enhance and sustain the engagement of local actors in these really critical discussions. Pedro, over to you.
Muchas gracias, Gema. ¿Me escuchan bien ahí? Ok. Bueno, gracias por invitarnos a este espacio tan importante para las organizaciones locales. Eh, eh, Antes de comentar cuáles han sido esos aprendizajes, es importante contarles que el grupo de trabajo de localización en Colombia, que hoy día se denomina Panal Colombia, nació en el marco de la iniciativa Flagship de OCHA en medio de todo este proceso de reajuste humanitario en los países que fueron seleccionados para este pilotaje. Hace poco más de 2 años venimos haciendo este ejercicio de poder reunir a las organizaciones locales, hacer una caracterización. Tenemos una página web, tenemos los datos de todas las organizaciones y un poco más de 300 organizaciones nos reunimos cada mes para trabajar sobre el tema de localización en el país. Em, en medio de este reajuste, la arquitectura humanitaria de Colombia tenía dos estructuras, una que se encargaba de los temas humanitarios de paz y desarrollo y otra estructura que se encargaba específicamente de el tema migratorio, los flujos migratorios mixtos. Estas dos estructuras han venido fusionándose y ya en este momento se llaman equipos humanitarios locales o equipos locales de coordinación en los cuales se está tratando de integrar todos estos temas para no tener una una arquitectura humanitaria tan compleja y más en medio de este proceso de reajuste. Nosotros hemos venido acompañando en el coliderazgo, en la copresidencia de este espacio, junto a la organización Corporación Infancia y Desarrollo. Nosotros como Apoyar somos una ONG que estamos en la periferia del país, en un territorio en el cual confluye tanto el conflicto armado por muchos años, como los flujos migratorios mixtos, porque estamos en la frontera con Venezuela y debido a la crisis de Venezuela, pues somos una de las entradas de la población que se está moviendo de este país hacia el norte, pero adicionalmente también tenemos eventos por variabilidad climática, principalmente inundaciones. Entonces, en este escenario del reajuste humanitario, hemos podido, por ejemplo, lograr cosas importantes que antes no se tenía la posibilidad que una organización local, por ejemplo, ocupara una silla en el equipo humanitario país. Esa es una de las cosas que hemos venido conversando con OCHA y que hemos logrado concertar que nosotros como Panal Colombia, el grupo de organizaciones locales, podamos sentarnos también a discutir sobre la respuesta humanitaria o sobre las acciones que se deben seguir en las diferentes zonas del país. Por otro lado, también hemos logrado acordar con OCHA, quien se encarga de la coordinación, sobre los espacios subnacionales de coordinación humanitaria. En Colombia tenemos 16 espacios subnacionales de coordinación y estos espacios históricamente han sido liderados por agencias del sistema de Naciones Unidas o por ONGs internacionales, pero no por ONGs locales nacionales, es decir, organizaciones colombianas. Y este ejercicio a través del flagship y ahora Panal Colombia también nos ha permitido concertar con OCHA que estos espacios subnacionales puedan ser liderados por organizaciones locales para tomar la decisión de la respuesta humanitaria en cada uno de estos escenarios. En este momento lo que estamos haciendo es conversando con OCHA sobre la importancia de la financiación que se requiere para que aquellas organizaciones locales que tengan la cualificación y de manera voluntaria decidan coordinar estos espacios puedan tener la financiación anual para poder pagar la coordinación y la persona que se encarga de la gestión de la información, que son pues dos profesionales súper importantes, claves en este trabajo de coordinación humanitaria. Estamos en ese punto, creo que hemos avanzado mucho en este trabajo de la localización y de poder darle un papel protagónico, o más bien que se haya reconocido la importancia del conocimiento que tenemos las ONGs locales y cómo podemos aportar tanto a las agencias del sistema como a las ONGs internacionales a tener una respuesta más pertinente a las necesidades de las poblaciones con las cuales estamos trabajando. Gracias, Gemma.
Muchas gracias, Pedro. Fantastic to have you on the line and really remarkable to hear about that work that you and other local actors have done to really take up those leadership roles in Colombia, but also your reminder that when local actors take on these roles, resources should follow, and that we shouldn't be asking local actors to take up these roles and just expecting them to do it on top of everything else, especially when we know that local actors have been hardest hit by the funding cuts all of the data tells that story. So really critical that when local actors take up these roles, which we all are so passionate in ensuring is possible, that resources should follow and support that. So Pedro, thank you so much again for those examples of the way that local actors have come to the table, both at national level, but critically also in leading subnational coordination there in Colombia. Cassia, Nomi, Pedro, thank you so much. I am going to keep moving us along because we have an incredible group of actors. So colleagues, that first discussion was really the humanitarian reset so far. If you have questions or reactions for Cassia, for Nomi, for Pedro, please feel free to pop them in the chat box. And I'm going to keep us moving along now through the rest of our discussions. But we will have time for more questions and answers at the end. But if you want to pop a message in the chat box now, please feel free to do so. With that, we're going to shift into part 2 of the discussion. And here we're really going to look at how are partners adapting to these really dramatically changing circumstances that we find ourselves in. And to kick us off on this discussion, I'm thrilled to welcome Elise, who is the country director of the Norwegian Refugee Council in Myanmar, a country faced with such complex circumstances and often so neglected globally in terms of the conflict there. Elise, at the time of the interagency system wrestling with prioritization, organizations also face their own internal prioritization challenges. So we were facing this in parallel. What was your experience? NRC co-leads the protection cluster there in Myanmar as a protection cluster partner of these parallel internal and external prioritization exercises, and how did you manage to keep protection central within them? Over to you, Elise. Thank you so much for joining us.
Thank you so much, Gemma, and thanks for the question. I think the short answer was extremely challenging. NRC is a recipient of former BHA funding, and so we had a direct impact on our response planning for the year. But we were also recipient of US government funding for the external coordination and the hosting roles we were supporting in several clusters in the country, including the protection cluster. So we were directly and immediately impacted on our direct response implementation, but also on our capacity to continue to support the external coordination in Myanmar. Maybe a few reflections on how we manage this. I think on the cluster side of things, the protection cluster did a really good job at the time to manage the decision-making process on the reprioritization exercise. And in a way, as a member, the NRC protection team did not feel so much pressure to support the cluster reprioritization work because the coordination team took a lot of that responsibility on their shoulders to also allow the members to continue to focus on their internal prioritization discussion and to work on more standard cluster tasks. It's also important to highlight that as we were grappling with all of those context and funding changes at the end of March, there was a massive earthquake hitting central Myanmar that demanded an urgent and large-scale response to support the communities that had been affected by the earthquake. So we had to, as an organization, but also as a cluster member, reprioritize again, working on the humanitarian reset priorities, but also scaling up the response to manage the earthquake response at the same time. Eventually, for NRC, we got the US government funding back, humanitarian funding back, that allowed us to then recommit to our support to the protection cluster and other coordination role. Maybe to Pedro's point as well from Colombia, one of a very immediate impact it had for NRC and our protection partner in one of the subnational area is the initial suspension of the US government funding stopped an initiative we were just launching where a national organization was taking the co-coordination lead role in a subnational cluster. So we were just starting this partnership to empower a local actor taking on this role at subnational level, and all of that had to be suspended for about 3 months until we had assurances from the donor we were able to resume. So I think those are very clear immediate impact that have, as it's been said by Colombia colleague, impacted first immediately local actors as well. I think the way we have approached this situation of having to prioritize internally and externally at the same time was really about ensuring strong internal and external communication and information sharing. At the end of the day, we were all caught up in the same whirlwind as the funding cuts were across the board impacting all actors in all sectors. Although the timing of the impact was a bit different depending on the organization, it felt maybe INGOs like NRC and national NGOs were impacted very early on and immediately, while other organizations may have been impacted a few months later. So the impact was also spread in time. So it's been very important to ensure that our internal decisions that we were taking that were maybe having an impact on the response were communicated and shared early with partners, with the cluster colleagues for advice, for information sharing, but also for awareness so that we could understand collectively better what was the impact of the reset and the funding situation. Over to you.
Elise, thank you so much for that really concrete set of experiences from there in Myanmar. I think there's so much to unpack, but that last point that you raised around really openly and sharing transparently information as we were all faced with this is so important, and yet was so challenging because of the uncertainty. But to make sure that we collectively do the best we can, we have to be sharing that information across one another. And also for those experiences you shared around having to pause that partnership with a local actor, but trying to reignite it as soon as it became possible, and of the way that the protection cluster, our amazing coordination colleagues, carried the coordination burden whilst partners were faced with internal turmoil and prioritization. Thank you so much again for that, Elise. We'll now shift across to Mozambique, and I'm really thrilled that we have Javier online, Javier Creech, who's the UNHCR representative in Mozambique. Javier, I know there's been healthy debate in Mozambique around how we either do integration or effectively carry out protection, and how we combine resources in a crisis that really does not receive the funding or attention that it needs to ensure the coverage, but also that specialized services continue. So all of these tensions, Javier, we'd love to hear from you from a programming perspective, from your perspective in these discussions. How do we go forward, and what do you think's worked well versus the challenges? Over to you, Javier. Thank you so much for joining us.
Hello, Gemma, and good afternoon to all. Good morning to Colombia. I hope you hear me well. You know, reading the questions, and I don't want to have a philosophical debate, but I don't think we can oppose integrationist approach and specialist services. I would even like to say the opposite. I would like to say that it's because we have specialist services that we can aim at having an integrationist approach. But you asked me about Mozambique, not about theory. I think the way we did it in Mozambique is precisely to work across clusters, and OCHA played a fantastic role, especially in having joint prioritization criteria beyond clusters, with the importance of the centrality of protection. Again, without protection at the center, I think protection people, we are those who connect people to services and to an approach. So us, we have used 4 main prioritization criteria. The first one is linked to the severity of the situation, to the protection risk, to have a focus where the conflict hits harder people. And this is, of course, always a debate, because should you focus on areas with the highest concentration of needs, very often urban centers, because we see more and more displacement, or on the contrary, where you may have less people, but because they are in a hard to reach area, because they are at the core of the conflict, their protection risk are much higher, their needs, their specific needs are higher. So I think the importance of having this joint analysis and to combine the two factors. The second one is also a very solid analysis in terms of gaps analysis. And it's very important that we all have a common understanding on that. You know, in Mozambique, the need for specialist services for child protection, for gender-based violence, for people with disabilities, for example, for these three obliged us or drive us to have these three specialized services maintained as a support to a longer-term integrationist approach. So analysis in the gaps, joint analysis in the gaps of the response to know where to scale up and what to scale up. Third one, of course, in the context of the financial situation, is efficiency and impact. I think it is absolutely essential and to really target one of the most important services to provide because of the impact they will have. You know, in Mozambique, more than 75% of IDPs have zero form of documents. Neither birth certificate, no ID cards. You can try to establish services like health, like education, but without services, it will always be reliable on parallel system. So for example, prioritizing access to displaced population to this documentation has an immediate impact. And this drives me to the fourth criteria, durability and sustainability. I think the need to strengthen local system, the need to strengthen community intervention are absolutely essential, not to spend the money too fast, too quickly, but with a too short-term intervention. This said, you asked me also about challenges, and I think there are three challenges. The first one is priority marking. And priority of donors do not always match priorities that you have identified in the cluster, whether it's a production cluster, whether it's beyond. So this is the first problem, is that donors have priorities who are sometimes set out at the global level, who do not take into account the reality of the country, and you have to play with the priority you have done at the country level and the priority of the donors. Second element that I find more and more worrying, and I don't know what the GPC thinks about that, but my impression is that clusters are barely ever involved by donors in this earmarking. I find that donors have a tendency to go agency by agency or NGO by NGO, and after clusters have to coordinate a response based on funding that they have not been involved in. I think it's essential to put the clusters back at the center of the dialogue with donors so that they can precisely have this discussion on prioritization and implementation. And the third one, the third challenge is how do you maintain donor interest? You know, us, the conflict started in October 2017, 8 years that we are involved in these 3 points. When I say we, I mean all agencies. Very difficult to maintain donors' interest when you're far away, invisible emergency. So I think the need to communicate on protection risk, on protection achievement, protection impact are absolutely essential. I think I'm already beyond my 4 minutes, but it's quite a complex question, Gemma. Back to you.
Javier, thank you so much. And any extra time was extra time well spent. So hugely appreciated both that breakdown of looking at this joint criteria, having those really difficult conversations, looking at these elements of gap analysis, efficiency and impact, durability, but also these really challenging questions, severity, making sure we reach the people who are facing the most life-threatening, but also acknowledging we may be able to reach more people elsewhere. These are exactly the difficult debates that I think have been unfolding across countries. And I think your first point that we have to have the specialized services in order to be able to integrate is one that I think most colleagues on this call would share. Let's then go back to the DRC just briefly. Naomi, in February 2025, UNFPA raised the alarm about the financial cuts and the consequences this would have for women and girls in the DRC. 9 months on, how do you see the impact of these aid cuts on women and girls? And how do we try in this circumstance to safeguard quality and specialized services for women and girls within this devastating context of both a growing crisis and aid cuts? Over to you, Naomi.
Thank you. So first of all, it's important, I just said in my previous response that protection was doing well in terms of financing in comparison with other sector, but GBV is not doing so well because the protection sector is financed at 6%, but GBV is now financed at 30%. So that means that the impact of the cuts was particularly heavy on GBV. And that's also why, because the US was upon time and also historically has been one of the pusher of the GBV agenda and the supporter of the GBV agenda with Hillary Clinton visit in 2010, and that's the history of that. And in particular, they were the provider of a large part of the pipeline of the post-rape kits. So with the withdrawal, we had this huge immediate lack of post-rape kits, with also the looting of the UNFPA contingency stock in Goma at the same time. So this filer asked the protection cluster, and actually UNFPA as a lead agency for GBV, to act as provider of last resort. So the positive side of the story is that we had quite a good response by the donors in the terms of your question about how we tried to safeguarding the quality, the specialized services with these limited resources. We had a very good response of donor who stepped up with top-up funding or with specific effort on the post-rape issue, because DRC has a huge amount of reported case, also because there is a national database. There is, like as I say, 20 years of response on our shoulder. And this creates like a number of cases, which is one of the largest in the world. We have like 80,000 cases per year. So we need to have the pipeline to respond to at least half of the survivors, because they actually arrive frequently on the 72 hours. So the first thing was looking at the priority, enhanced resource mobilization for specific things. And for DRC, a lot focus was on restoring the supply chain for post-rape, because the major US funds was gone. And we work on enhancing coordination, because we had already a lot of engagement with women-led organization. We had the history of the call to action roadmap and all the engagement by the women-led organization. So this specific investment on coordination or resource mobilization on specific target of activities in integrating services, linking a lot with health, of course, was the kind of strategy that Hello has to continue with the specialized services. Donor diversification helped, because a lot of donors step a lot with small amount, medium amount, large amount, but we had a very diversified portfolio, in particular from GBV, for support of specific things. And in terms of UNFPA, it helps, of course, the integrated approach for health, because the midwives can be the entry points for all the aspects of sexual reproductive health and so on. And the other thing that we look at was not only the prioritization of efficiency and the specific elements, even in coordination with we put in place a clinical management of rape task force with colleagues from the health cluster and the protection cluster working together on this referral pathway. It was completely destroyed because more than half of the GBV actors disappeared. Also, not only the post-rape kit disappeared, but also the GBV actors. So this kind of prioritization, coordination on this efficiency, targeted support on one side, the alternatives on the other side, the diversification of donors, like scaling up the investment on women-led organizations who were already partnering. So there was a very fertile environment. And also the example I did about UNFPA specific integrated approach, which is not the only one. IRC is doing the same, IMC doing the same, Intersource, a lot of the NGOs use this similar approach. And the last point was the shift to adaptable service model, maybe capitalizing on what's existing and what was also sustainable in DRC. So using a little bit more CVA to address also the socioeconomic needs and requests by the survivors. A smaller amount, very specific cash in protection work, using the one-stop center who was already working in DRC, because there are many. There is the very famous Pansi, and there are state ones in North Kivu, there is in Africa. There are a lot of actors who use this model in DRC with a national model. So use them, they are already there. They just need to be reinforced during the highest moment of the crisis. So the referral with the cash is easier to do. And the last thing is like prioritizing the training, because the capacity building has to be always there, because there is change in actors and so on. It's humanitarian response, but this linkage with training needs to be adaptive and like ready for the service that are actually requested and needed. So that's how we try to respond to the situation.
Thank you so much, Naomi, for walking us through that devastating loss of capacity in the GBV sector, but due to the funding cuts that came so suddenly and that were so reliant upon the US funding, but also just humanizing the fact that those 80,000 cases a year, every one of them a person subjected to horrific sexual violence in need of post-rape care, and that work that was done across the sectors, health, protection, and others, to really come together to make sure that that referral pathway was reestablished for people who so desperately need it. So thank you for walking us through that. Also the donor diversification, and this goes back, I think, to Javier's earlier point about how donors can be responsive to the priorities coming from colleagues on the ground, and that this is such a critical part of good donorship today. Let me then go, and we're a little behind time, colleagues, but I promise we'll make it back up, over to Syria. And I'm really thrilled that we're joined by Mossab and by Ahmed, who work for a local protection partner, IYD, specifically working on trafficking of persons in Syria. Mossab and Ahmed, thank you so much for joining us. As a local protection actor in Syria, how are you adapting your programs and your engagement with communities as you work to try and address these really critical protection risks, especially trafficking in persons? Over to you, Mossab, and to Ahmed.
Thank you, Gemma. Good afternoon, everyone, and thank you for this opportunity. This is Musab. On behalf of IYD, I would like to express our appreciation for this coordination meeting under the Global Protection Cluster. Actually, in Syria, protection risks are growing as humanitarian resources continue to shrink. As a result, people are facing increased exposure to violence and exploitation. Not only this, but also for child labor and harmful coping strategies. While certain forms of exploitation and trafficking are becoming less visible due to decline in funding, regarding all this, and to continue protecting communities in this challenging context, we have adapted our work in 3 key ways. The first key way that we are adapting and we are working with as IYD, we have strengthened the integrated protection across sectors. And this is by linking the referrals with essential services such as livelihood support and other care support. We ensure that survivor of GBV, exploitation, or other protection risks receive both immediate assistance and longer-term support to prevent any re-abuse. This integration approach fosters the stronger coordination between sectorial teams, ensuring that holistic and sustainable protection outcomes for affected individuals. And for example, now we have women's group supported in Aleppo Governorate in member city under one of the SCHF projects. Now receive safe referral from the protection team to the ERL team, gaining access to opportunity that help restore both income and dignity. Over from my side and over to my colleague Ahmed to continue the second and third key approach. Over. Ahmed, over to you.
Okay, thank you very much, Musab. Good afternoon from Syria. This is Ahmed Abdurrahman from IYD. It's a great honor to participate in this global protection meeting. As for the protection risks, IYD, in coordination with our donors like SHF, IOM, we also support the communities that lead early identification and prevention. Since the protection committees and voluntary teams are the central actors in spotting risks early, whether violence, unsafe movement, or deceptive recruitment, and in connecting individuals to services through trusted referral pathway. And this referral pathway, as IYD, an active member in protection cluster sector, we receive updated service mapping monthly from the protection sector in Aleppo and Damascus hub. Also, we remain fully engaged in protection cluster system. IYD coordinates with the government, with the protection cluster and sector active member in the HLB working group, Mine Action working group, CB working group, GBV working group, and we attend the meetings and participate effectively in these meetings. Also, we are a co-lead of HLB working group. This coordination and collaboration with the associations of protection and government facilitate implementing our projects. Also, this helps us to ensure that specialized protection concerns, including trafficking, are not forgotten in prioritization discussions, and that local actors continue to influence decision making. On this point, IYD rehabilitated the begging center, and a lot of types of trafficking like begging and child labor and recruitment. We rehabilitate begging center in coordination with the government in order to mitigate this high risk, protection risks. Also, we are looking forward through localization. Localization must be more than participation. Local actors are closest to community, and sustaining their role is the most effective way to prevent protection risks from escalating into emergencies. We adapt this in 3 points, which considered are crucial. Number 1, localization must go beyond participation. Local actors need to be involved in decision making, not just implementation. Donors, and we hope that, should consider multi-year flexible funding to preserve specialized services, protection services that can't be rebuilt quickly once lost. And finally, the humanitarian community must continue to center protection within all sectors, because reducing and mitigating protection risks reduce humanitarian needs overall. Thank you very much for your listening. Over.
Shukran, Ahmed. Shukran, Musab. A huge thanks for running us through that incredible work you do on the ground to sustain protection in Syria, and really highlighting this critical piece around connecting people with trusted services, and that so often it is the local actors from the communities that people who are in crisis are from themselves, who are the most trusted, and really stressing the importance that local actors are decision makers, not just participants. Huge thanks for all of that. Colleagues, we're now going to shift into the last part of today's panel discussion, and here we're going to look ahead. So we've heard how this amazing group of colleagues, and I know so many of you who are online today, and just to stress again, any panel can only have a certain number of speakers, but we know there are many of you online with incredible experience across the world. Please feel free to share your experience in the chat box. But we've heard from our panelists how they've managed to keep protection central, to keep it prioritized, to integrate it into responses to date. So how do we now go forward? And we're going to first go to Cassia in Ukraine, looking at the response capacity, the constraints constraints, the challenges, your forecast of what's possible. What do we need to consider, and what strategies can we put in place to ensure an effective and collective protection response in Ukraine as we move ahead? Over to you, Cassia.
Thank you so much, Gemma. I'm thinking about three main points. One builds already on what I have been saying. So it's really essential for us, given the funding constraints and the ongoing humanitarian research, to really stay nimble, not be overly technical, to be able to speak to those others in the multi-sectoral responses that we are shaping up in Ukraine. And make sure that we link up our protection activities and services to these 4 strategic priority areas. And it's very clear how they contribute at the operational level, but also at the strategic level that we've been pushing for. So both of these levels are very important. We have a few protection activities, those softer ones like advocacy, information provision on services and rights, and capacity building, which are of course challenged in this resource scarce environment, where I think we really need to put an extra effort together with a wide range of protection actors to, make sure that they are considered efficient, linked to the services we provide. Power cut in Ukraine, so sorry. This is our reality here. That we keep them pragmatic, and they're really geared to supporting localization, complementarity with government services, and quality programming, because we cannot give up quality programming even if resources are shrinking. Second point, dive more into transition. We've been doing this work. I'm a big supporter of starting transition the moment we start the responses. And there is work done. Humanitarian coordinator offers his opportunities through what we call a transitional bucket, which is an envisaged annex to the HNRP. We really need more thinking to focus and maybe ask ourselves first the question, what are the government services available already, then identify the gaps, and through that determine our relevance and our niche and value added in protection. And the last point, simply leverage the work we've been doing through the issue-based approach and humanitarian needs and response plan. With the strong AAP approaches, we have some great mechanisms in Ukraine, like IDP councils, that we can explore and make sure that other parts of the response are as well engaged, galvanize our joint strengths in the protection cluster with child protection colleagues, GBV colleagues. We have some great good practices. We need to build on them. And continue informing the informing the humanitarian response and the strategic 4 priorities through protection analysis, determining what are the key risks and who are the groups that are most at risk. So that's what I see for us going forward. Back to you.
Thank you so much, Cassia. How do we keep it simple so that everyone can understand how protection plugs in and why it's so important? Making sure collectively we commit to quality, even in a time of drastically restrained resources, and how we connect these AAP efforts both to protection, and then how we connect our broader efforts to transition from the start, to plan these ethical exits that we all think are the important way forward. Thank you so much for that, Cassia. Let's move back to Colombia, to Pedro. Pedro, based on your experience and everything you've been through these last 9 months, but more broadly, how do we enhance local actors' role in protection and in the overall response moving forward? I think you already shared that so much is happening in Colombia, so we can learn from that for other countries. But do you still have further ambition, more to do, more you think should be done? Over to you, Pedro.
Muchas gracias. Bueno, según nuestra experiencia, como apoyar, mejorar el rol de los actores locales en la respuesta de protección requiere, primero, reconocernos que no solo somos unos implementadores, sino que somos aliados y socios estratégicos para la comprensión, el diseño, la implementación y el monitoreo de las respuestas. Como les decía hace un momento, en contextos como Colombia y particularmente aquí en Arauca, donde se encuentra nuestra oficina principal, Hay múltiples afectaciones, conflicto, flujos migratorios y pues eventos por variabilidad climática. Eh, la cercanía de las organizaciones con la comunidad permite leer el contexto en tiempo real, identificar riesgos emergentes y adaptar las estrategias de protección a las dinámicas locales. Creo que ese es un valor muy importante que tenemos las ONGs locales y es ese proceso de construcción de confianza con las comunidades la que nos permite tener información de primera mano para actuar en momentos de crisis. Desde apoyar hemos aprendido que fortalecer el rol, cómo fortalecer el rol local se podría dar en tres dimensiones. Uno, la confianza y la corresponsabilidad. Los actores locales tenemos lo que decía hace un momento, la legitimidad comunitaria. Somos parte de ese tejido social para que la respuesta de protección sea más efectiva. Nosotros consideramos que los socios, tanto agencias como ONGs internacionales, quienes son los intermediarios al momento de dar la respuesta, deben confiar en esa legitimidad que tenemos como organizaciones locales para promover una toma de decisiones que sea compartida desde la planeación de la misma respuesta hasta la rendición de cuentas. Otro aspecto muy importante es que podamos tener recursos flexibles y sostenibles, y esto pues está muy pegado con el tema de la localización, que esta no es posible si los recursos no llegan directamente a las organizaciones locales. Es necesario promover mecanismos de financiación directa a largo plazo, que sean un poco más sencillos, menos burocráticos. Muchas organizaciones locales no alcanzamos a cumplir los criterios de la debida diligencia y creo que esa es una de las cosas que tenemos que pensarnos muy bien para permitir que muchas organizaciones pequeñas con gran experiencia y que han construido una red de confianza con las comunidades puedan acceder también a estos fondos para dar respuesta frente a las necesidades. Eh, Otro aspecto es el reconocimiento de lo local. Los actores locales hemos desarrollado enfoques innovadores de protección, como la protección comunitaria, por ejemplo, que impulsamos desde apoyar junto a Oxfam Colombia. Estos enfoques combinan no solamente el conocimiento técnico, sino que los saberes comunitarios, y esto ha permitido construir unas redes de cuidado, unas rutas de prevención de violencias basadas en género principalmente, que es nuestro enfoque, y unos mecanismos de autogestión de la protección. Finalmente, fortalecer nuestro rol también pasa por participar en espacios globales de decisión o espacios donde, por ejemplo, como este foro, estamos compartiendo las experiencias que nos permiten fortalecernos unas a otras dentro de este sistema de todos los actores de la acción humanitaria. eh, las voces locales las voces de las organizaciones locales podemos visibilizar las voces de las comunidades y de las otras organizaciones para poder incidir en las prioridades humanitarias. Muchas gracias.
Pedro, thank you so much again. So clear. Local actors are part of the social fabric, and they have to be seen not as implementing partners, but as allies, true partners, true decision makers, as Ahmed reminded us from Syria as well, and the flexibility and sustainability of resources going to organizations such as your own, absolutely critical. And then these innovative, important approaches that are possible because local actors are on the ground, community-based protection, local voices, all of this because you're so much a part of that societal fabric. Colleagues, I wanted to flag that we did have another panelist from a local organization, Dr. Daniel from communities in need of aid in South Sudan. And he unfortunately wasn't able to join us, but I'm sure we'll be able to hear him another day. Colleagues, we've got just 2 more discussion points from our side, but we're right at the end of the panel. So please feel free to pop questions that you'd like to pose in the chat box. I'll see if we have time for them. And otherwise, I know the Global Protection Cluster will be taking really close notes so that we can pick up on the points you raise. Without further ado, I'm going to go 1-2 to Elise in Myanmar and to Javier in Mozambique. Elise, what lessons have we learned through the reset in terms of how protection is perceived and strengths and weaknesses in the response? And do you have recommendations around how we keep protection at the top of the humanitarian response agenda in 2026? And Javier, I'll pass the same message, the question to you. So Elise, first over to you, and then we'll go to Javier, and then colleagues will begin to wrap up. Elise, over to you.
Thanks, Gemma, for the question. So obviously the humanitarian reset is very much still ongoing in Myanmar and elsewhere. So maybe 2 initial lessons to keep in mind. The first one is very similar to what colleagues have said already, Kasia in Ukraine, mentioning that the humanitarian country team and the coordination team jointly ensuring support to maintain protection as a priority. In Myanmar, it was a very early call and a very early confirmation from the HCT that despite the prioritization, protection was going to remain a priority of the response. And that really allowed to set a solid base for the following discussion to ensure that protection was still at the center of the discussions. The other maybe lesson learned has been a bit more on the merger of the protection cluster and the AOR that is still ongoing, and a lot of effort has already been done in Myanmar thanks to the protection cluster and AOR colleagues. It's been helpful to receive guidance from the global level. So it allowed the discussion at the national level to be guided and to receive some additional support and instructions on how to get this done without disrupting the response and the support provided to the protection partners. And that's probably a good practice to continue keeping in mind as the reset continue to unfold in different components. In terms of recommendations, I'm not trying to have an exhaustive list, but maybe a few to consider. The first one is obviously this lesson learned that keeping protection at the center, having that leadership at the HCT level to ensure this is done, needs to continue. And in that regard, it's very important we continue to see protection as both a specialty, but also an overarching goal with centrality of protection, especially in places where root causes and risks faced by people in need of protection are related to safety and protection risks. I think there's a lot of what the colleague in Colombia, Pedro, has said that resonates a lot with what national and local actors are saying in Myanmar. And maybe a recommendation to the protection cluster is how do we ensure that the reset and the discussion on how we restructure and revise the coordination system and the protection centrality in it also considers those very clear requests from the national and the local actors around empowerment, representation, and a sit at the table. So it's going to be very important to keep that in mind. And linked to this recommendation is how do we leverage the strategic advisory group of the protection cluster at national level to make sure that the membership and the representation balances well the need for localization understood as empowerment and representation of national and local actors, and the need to ensure we have representation from the providers of last resort, especially in a merge cluster situation. And the last recommendation would be in Myanmar, and I imagine it's also the case elsewhere, we are discussing what the subnational coordination level is going to look like, with options to move towards greater use of multi-sector, area-based approaches. And if that's the preferred coordination structure for the subnational level, then it will be very helpful to have guidance and advice from the national and global protection cluster on how do we collectively, again, monitor whether the protection issues are timely and effectively addressed, and whether they need to be escalated to national protection cluster and or to the HCT when needed. I'll stop here. Thanks, Gemma.
Thank you so much for those forward-looking reflections. Elise, let me go straight to Javier, and then I'll come back. And again, colleagues, if you have questions, comments, please keep putting them in the chat. I've seen great contributions around local and national actors. Even though they've been cut, they've stayed. There's a lot coming through the chat. So if you have any last critical points, please do pop them there. But first, let's go to Javier.
Thank you. I was thinking that it's not easy to come after Elise, Pedro, Casia, and that they've already said it all. So I also try when I spoke about the challenges after the first question to make some recommendation. So maybe some specific points which came to my mind. I find that in the context of the growing needs while financial situation deteriorates, communities, local authorities, and donors have a bit an over-focus on what I would call material assistance. What is less material, like protection, is often deprioritized by everybody. They want to receive something in kind that they can touch in their hand. How do you work on mental health in this context? And not only mental health for GBV victims, but mental health for young men. It comes at the end of the priority. Same for HLP. I find that housing, land, and poverty is more and more overlooked. It's very often land issues are very often a cause of the conflict. It's also very often a challenge to protection and solution. I think this must also oblige us protection people to introspect. I think we are very good at speaking to each other. We are very good at speaking to people who are already converted to protection. But I think we're struggling to explain what is protection is about to non-protection actors. So I think we must do an extra effort to explain that. Otherwise, we will always fall into the crack. On the one hand, the core relief item, food ration, humanitarian assistance. On the contrary, the development infrastructure intervention. We see it at the middle. We don't see it at the middle. We're here from day one to the end, but if we're unable to make an effort to articulate. So I think this is very important to explain that protection might be less tangible, less touchable, but absolutely fundamental to restore people in their right, in their safety, in their dignity. Second point about the humanitarian reset, the famous adapting to local context. Of course, we should adapt to the local context, but adapting to the local context, to the local realities, should not be an excuse to maintain business as usual. And I sometimes feel that we always pretend that the local context is so specific that we should not change anything. So on the contrary, adapting to the local context, for me, it's not maintain business as usual, is on the contrary, how do you improve relevance and efficiency? So I find this absolutely essential. The humanitarian reset, I find it an opportunity for leading structure to have a cluster and other coordination mechanism focusing exclusively on the response, less coordination for the sake of coordination, but really coordination for delivery. Thanks, Gemma. Back to you, sorry.
Thank you so much, Javier. And colleagues, I think there's been so much here. I'm sure you'll agree, an incredibly rich discussion. I'm just going to give 1 minute as we just approach the wrap up to see if anyone wanted to come in. And I see a hand up from Naya. Naya, did you want to take the floor? Over to you.
يس شكرا جيما شكرا ما بعرف إذا الترجمة يمشي الحال. شكرا جيما على التيسير. شكرا جميعا على المداخلات اللطيفة والغنية واللي هيك at some point بتقرب النضالات من بعضها حول العالم. وبنفس الوقت مجهود الحماية. لكن بدي ألفت النظر أنا لنقطتين بما يتعلق بالوضع بسوريا، بلكي مصعب وأحمد ممكن يلفتونا بدقيقة أو دقيقتين كيف عم يتم التعامل مع قضية المختطفات السوريات مثلا، وكمان المركزية بالاستجابة للشؤون الإنسانية والمخاطر. يعني مثل ما سمعت كان في تركيز على حلب ودمشق، بعيدا عن التركيز مثلا على المناطق مثل الساحل السوري، السويداء وغيرها من المناطق اللي يمكن تكون عم تشهد بعض النزاعات أو المشاكل الداخلية بسوريا. فهي نقطة. النقطة الثانية I think بدي أركز I would love to mention that التركيز كمان على تحليل مخاطر الحماية، الأمور اللي بتبقى قبل وقوع الخطر هو مهم بنفس الوقت. فتحليل البيئة اللي احنا موجودين فيها، تحليل السياقات الفاعلة فيها، تحليل الجهات المشاركة بهاي المخاطر، لحتى نفهم كيف يعني وقت تجينا حالات لنستجيب لها نكون فاهمين السياق من يعني من أي طرف عم بيكون هذا العنف جاي بشكل متكرر ومستمر. شكرا جميعا على المداخلات، وشكرا على المداخلات اللي من دول أفريقيا والبحر الكاريبي.
Naya, thank you so much for raising those really important questions. Ahmed, I'm going to give you 1 minute to respond, and then I'm going to come back to close out the panel with a few bigger picture pieces. Ahmed, over to you.
Okay, thank you very much. As for the centrality of protection services in Aleppo and Damascus, I would like to highlight this point that the centrality is related to the protection cluster and sector and the coordinators who coordinate the response. As for the organizations, we responded to coastal emergency and Asweda and Dara response. IYD responded to this and received fund from AFNS and IOM, and we highly appreciate their support, IOM and AFNS and SCHF for these responses. So the centrality just to coordinate, just to push and support the partners to target these locations in emergency. And also IYD, for example, were pre-selected from SCHF allocation in a project to respond to the emergencies that may done at any time. The second point for the kidnapping cases, as a protection, we continue awareness raising the community members and through training them, building their capacity to these issues. Also, we provided them training related to trafficking. That I already received this great training from IOM, and we thank them for this valuable scientific material. Then, when we receive any referral or any request from the members of communities about kidnapping, or evacuation or any case, we coordinate with the cluster. We also coordinate with the government and authorities in order to take the procedures, guide the people how they have to follow the procedures and how they have to behave in order to mitigate any protection risk and preserve them. The second point for protection. Thank you very much.
Sorry, could I just give you 30 seconds to wrap up, and then we'll continue on, and I hope to continue the discussion in country in Syria. Back to you, Ahmed, to wrap up.
Okay.
I'm so sorry, Ahmed. I didn't mean to cut you. Did you want to finish just quickly?
As for 1 minute, as for analysis the data of protection, we IYD and all other partners upload the data of protection monthly on Damascus Hub platform. This platform analyze these data and publish the results on relief dashboard. Thank you very much.
Shukran كتير, Ahmed. And thank you, Naya, for the questions as well. Colleagues, we're right at the end of time, and I just want to do a couple of things. Number one, please join me in thanking our incredible panelists today. Thank you, Pedro. Thank you, Mossab and Ahmed. Thank you, Elise, Cassia, Noemi, and Javier. I hope I've not forgotten anyone. Truly, truly appreciated this opportunity to hear from you across contexts, across continents, about how you have kept protection central. Something that Elise said really stood out to me. Choosing to make protection central at a strategic level is not one-off. It has to be an ongoing decision that we reaffirm every day, every week, in every humanitarian response. And I think secondly, to Javier's point at the end there are so many aspects of protection work that are not something, and I'll never forget a colleague at a protection panel previously said, you cannot load protection onto a truck. And so much of what all of you said today reminded me of exactly that, and that protection is not just for the groups of people who, you know, we all evoke sympathy for children, for girls, for women, but also for adolescent boys, also for men, and that we have to have this approach that truly encompasses the protection that people need, including mental health support. So colleagues, thank you for the experiences across contexts. Thank you for driving home really critical points that I want to reassure you are 100% part of the humanitarian reset, and the emergency relief coordinator, Tom Fletcher, is deeply committed to, number one, the role of local actors, not just as implementing partners or otherwise, but truly as decision makers at the table driving responses. Number two, that protection must be central, and that women and girls, in the way that we look at this, we are nuanced and we're providing responses that are appropriate. And Nomi, thank you for the examples that you brought from DRC around how you all came together on that critical issue, clinical management of rape and support to survivors of sexual violence, in order to make this a reality. So how we keep protection central. And number three, that in this time of hyper prioritization, because colleagues, it is horrific, but it is a reality. We have less than half of the money, so we have to come together around these difficult conversations as to how we best use that money. That as we do that, protection is not an add-on, it is not a side thought, it is absolutely central. And each of you on this call have made that the case in each of the operations that you work with, from local actors on the ground in Syria dealing with trafficking, through to the incredible work Pedro and colleagues have done in Colombia to bring local actors to the table, and the amazing work by our protection cluster coordinators. And I have to give a shout out to the protection cluster, because many colleagues spoke to how critical the work of the cluster was in keeping protection central, in making sure that these conversations happened, even when all of our own organizations were in disarray. And Javier even plugged a bigger role for the cluster in influencing those donor discussions. And my last point would be to donors. I think for those of you online from the donor community today, you've heard the incredible commitment, the passion, the dynamism, the creativity, the innovation, the way that all of these partners are keeping protection central to responses, the way humanitarian coordinators have supported them, pooled funds has supported that, and otherwise. But we need donors to come in behind this. It is absolutely critical. You heard the importance of flexibility. You heard the importance of being driven by the priorities of those who are on the ground in the countries responding to the crises, and the importance of making sure that any earmarking that is done does not disempower partners partners on the ground from doing what is right for people in crisis, which they are best placed to know. So colleagues, I will stop it there because we're 5 minutes over time, with just deepest gratitude to all of you for the incredible work. And I want to close out with just an individual story from Mama Noor, who's in Sudan. We didn't speak about Sudan today other than at the beginning from Dominique. Mama Noor works with a local organization in Sudan called Shahma, and they work with orphans, with divorced women, with single mothers. And at the beginning of the war in Sudan, armed men came to the place where Mama Noor works in Sudan and demanded that she hand over the women and girls who she cared for to them. She refused. She fled, including with pregnant women, to Wad Madani, and she reestablished all of the work that that incredible local organization, Shahma, that she founded, does. And to this day, they are providing assistance to women and girls in Sudan. And I know that every one of you on this call, from Somalia to Cameroon to Ukraine, and I cannot mention every other country, have stories like that. Let's keep sharing them. Let's keep amplifying them. And let's ensure that these partners, like all of you online today, who are doing this critical work, get the support that you receive. Thank you so much for joining us. Thank you to the Global Protection Cluster for organizing us. And thank you to all of you in advance for carrying this forward as we go into what will no doubt be a challenging year, but a year in which we can keep protection central in 2026. Thank you so much, colleagues.
Okay, thank you all.
Thanks a lot. Bye-bye.
Thank you.
Thank you. Bye-bye.
Bye.
شكرا جميعا.
باي باي.
Okay.
Thank you.
Bye, Harry.
Thank you. Goodbye.
Thank you very much. Bye-bye.
Thanks, everyone.
Look
Bye-bye.
forward to joining
Bye-bye.
sessions tomorrow, inshallah. Thank you.
Bye-bye. Thank you.